Everyone hopes that you can speed through labor like a NASCAR driver. Okay, maybe not that fast, but you're hoping that labor will not slow down. But what are some things that might make it so that this end of your uterus, called your cervix, slows down and does not dilate? Today, I'm going to go through different things that could be making it so that your uterus is not dilating as much, and what you can do to overcome those different things. Because we want that thing to chug along and dilate, right? There's no one out here looking for a slow, painful labor. Pretty sure. Maybe I should make a YouTube video and see if anybody watches it. Probably not.
All nurses to the nurses station.
And I just want you guys to know, these are things that I saw in my 20 years in labor and delivery, and I continue to see with patients online. Your uterus can be a mysterious place, but there are some things that tend to be problematic. And the first one is baby's position. If baby cannot find the right position in both the pelvis and in the uterus, it can make things slow down. This is why I am such a fan of using movement to help baby find their best position in the pelvis so that they can come down the quickest. And in fact, oftentimes babies start looking up, also called OP or occiput posterior, and then they slowly shift around so that they're looking down as they come out. And you need to help them do these things by moving yourself. During early labor, that can look like, lunges and squatting and just changing position very frequently. I have tons of videos here on YouTube about how to use movement to your best benefit during labor. But you're using that movement to help shift your pelvis a little bit. A lot of us think that our pelvis is just one stable thing. It's not crocheted, thankfully, but there is some movement from it. This symphysis pubis here is actually not hard. It is soft. So when you move, it can help baby find their best way down. Then when you get into labor, especially if you have an epidural, it can look a little bit different. Rotating side to side, using a peanut ball, all these different things that you can use to help baby find their best position. If baby gets in a wonky position, and yes, wonky is a very technical term, it can make it so that labor just stalls out. So we've got to use movement during labor, even if you have an epidural. If you're like, Hillary, I have no idea what you're talking about, I actually include labor movement cards to give you some ideas about how to move during labor in the online prenatal class for couples. I will link it down below. But another great option once you're in the hospital is to ask your nurse, hey, I would love to keep moving. If there's anything that you're seeing that we might help baby move into the pelvis better, please let me know. I would love to do that, because I got to tell you, a lot of patients just love to lay down and sleep, which may not be their best benefit to getting the baby into the right position. So use your labor nurse when you're in labor as well. Now, your uterus is a muscle, and just like any of the muscles in our body, when we are scared and nervous, we tend to tense up, and your uterus is no different, especially the cervix. So if you're really scared, feeling lots of anxiety, your cervix and your pelvic floor that's underneath us like a bowl is gonna tense up, and it's not going to open up to allow baby to descend into the birth canal. Things you can do to help with this is to learn breathing techniques that help your pelvic floor to relax even when you're feeling a little bit nervous. I'm not here to say that you can have a fear or anxiety-free birth. I think birth it's a nervous time, because when you have a baby, your whole life changes. Even if your birth goes absolutely perfectly, when you go home, things are going to be different. So it can be a little bit of anxiety anticipating what that's going to be like. But learning breathing techniques can both help you relax during labor, but the good news is it can help you relax during pregnancy when you get a bad ligament pain. I actually have a whole video on ligament pains I'm going to link to down below. And bad news, you're going to still have some contractions and pains after delivery, and those breathing techniques can help then too. But the best news about the breathing techniques is they help this pelvic floor to relax, to let baby descend into the birth canal, and hopefully help you to feel a little bit less anxious or nervous during birth. Of course, getting prepared can also help you. I call it the scary stack. When we come in the room and we're asking you all these questions and you're just not sure what's going on, it's like piling a bunch of books on your arms, a scary stack. But if you already knew that we were going to do these different things, or you already knew your answers to those questions, it removes the scary stack from you. So getting prepared can totally help. Prepared couples birth better, and their cervix will open up. It actually shows that people are less likely to have a C-section or even need an induction if they've taken a prenatal class. And I believe a lot of it is because they feel less tension and anxiety. And finally, the third thing is sometimes that's just how labor is. Labor may get to a point where it stalls out for a little bit. In the hospital, we can do things like increase Pitocin. Sometimes we feed you. So crazy, right? Sometimes there's different things that we can do, but labor ebbs and flows, right? Baby comes down well, and then it might cool off for a little bit. Your body has decided your uterus needs a little bit of a break, right? So it's not pumping the oxytocin in. So just because your baby isn't descending as well as you would like it to, doesn't mean that anything's wrong. It may just be your body taking a natural break. I think we so often look at like Sally down the block had her baby in just a couple of hours and it's taking me days. Totally normal. Everybody's labor is going to be different, and there can be ebbs and flows in labor, and that's okay. Of course, sometimes providers get a bee in their bonnet that labor should progress in a certain time lane, but you're always safe to say, hey, are me and the baby safe? Can we wait a little bit longer to see if, things move forward now? And that would be before starting Pitocin or maybe considering a C-section. Now, knowing that you even have those options can be really hard, which again is why I recommend a great prenatal class. Now, in early labor, sometimes your cervix isn't even dilating per se at all. It's just softening up, but you'll still have those things where it starts and then it goes away. I have a whole video on prodromal labor that I'm going to link to up here that's going to be really helpful about that. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.